Imagine, you're home with your family on Christmas Day. It's all laughter and smiles, until suddenly your uncle says he doesn't feel well, and he doesn't look well either. He's pale, he's complaining of shortness of breath, nausea, and he's complaining of chest pain and dizziness when he's trying to stand. What do? Last year, 1.5 million heart attacks occurred globally. 720,000 of those occurred in the United States alone, according to the American Heart Association. As a nurse, I feel like it's my responsibility to educate people about the number one killer in the world. So if the symptoms occur, another life can be saved. Being in healthcare, I'm constantly quizzing my patients on their discharge education about the signs and symptoms of heart attacks and other cardiovascular diseases such as strokes. My patients often don't know the symptoms, get heart attacks and strokes confused, or they think they're the same thing. Heart attacks and strokes both occur due to similar risk factors such as diabetes and high cholesterol, but what they affect is completely different. So now you may ask, why does it matter? It is stated that $444 billion was spent on cardiovascular disease in 2014. As you can see by that number, it's a growing epidemic. So what is a heart attack? Your heart, just like you, needs oxygen to survive. When you have high blood pressure and high cholesterol, your coronary arteries that supply blood flow and oxygen to your heart become occluded and weak. Eventually, if your cholesterol and blood pressure remain high and untreated, this ends up blocking these arteries in your heart, causing tissue death. So now that you may be asking, what's a stroke then? Caused by similar health problems, a stroke is caused by a blood clot or a fat clot breaking off and lodging into your brain, occluding blood flow and causing tissue death. So now that you know what causes a heart attack and a stroke, you need to know the symptoms and how they're different. In men, they often complain when they're having a heart attack that they feel the pressure in their chest. It could be pressure or stabbing. It can radiate down your arm or into your mid-back. They often complain of feeling short of breath, dizzy, nauseated, and they're very pale and sweaty looking. Women are completely different. This disease affects women more than men and kills more women than men because they often don't know that they're having a heart attack. They feel like they're just having heartburn, just in the middle of their chest. They take medicines and it doesn't go away. Eventually, the pain ends up moving up to their jaws, and that's the only symptoms they mainly have. Some women have reported feeling short of breath, but otherwise, those are the only symptoms women typically have. So now, what are the signs and symptoms of a stroke? Stroke symptoms affect women and men exactly the same. They usually include weakness on one side of the body, facial drooping on one side of the body, you have slurred speech or you can't speak at all, and a lot of the times people don't comprehend when they're being spoken to. So an easy way to remember the difference between a heart attack and a stroke is to remember that a heart attack, the blood flow is being affected to your heart, and in a stroke, the blood flow is being affected to your brain. Both of these are equally deadly, but if you know the symptoms, their survival rate is very high. So what can you do to prevent this from happening to your loved ones? The American Heart Association recommends that you see your doctor regularly as directed. Stop smoking if you do. Get your blood pressure, blood sugar, and cholesterol in check if it's high, and try to keep it in normal levels. Eat a low-fat diet. Exercise at least 4 times a week, and know your family history. If you're at high risk for this disease, then you need to know it so you can prevent it from happening to you. And another thing we all need to do is find ways to reduce stress in our life so our blood pressure doesn't get high. Knowing these symptoms can prevent you or your loved one to become a number of this 1.5 million people affected by cardiovascular disease in 2014. And you could help save another life as well. Thank you for listening.